Hey everyone, my name's Tom Walker, and I'm one of the founding members of New Paradigm Recovery. We're an intensive outpatient program located in Tysons Corner, Virginia.
And I'm Joshua Cagney. I too am one of the founding members, along with Tommy and a handful of others, in establishing the IOP.
So we're continuing a conversation surrounding recovery informed theory and recovery informed practice. So the application of recovery informed theory in treatment and therapeutic settings, and this idea of combining the objective with the subjective, lived experience being incorporated into treatment from the professionals that are providing that, how to build that in, why is this important, and ultimately looking at what makes treatment successful, and as opposed to looking at just the treatment of pathology, the cessation of symptoms, also looking at recovery capital and other strength-based measures for establishing recovery as the key indicators of successful treatment and ongoing outcomes. So this is a series of conversations between Joshua and myself to really help push out this idea of recovery informed theory and what New Paradigm is really applying in the intensive outpatient program. So we wanted to do a shorter segment for this second one to cover some things that we didn't in the first, to bring us kind of organically into the rest of the conversation. So in regards to objective data, right? One of the key outcomes that's always been considered most important is whether someone is staying abstinent from substances of abuse, right? So the question I have, Joshua, is should abstinence be the primary metric for success?
It's a great question. I know that in the first segment, we talked about success, and what constitutes success, and is abstinence success? These are hard questions, but I think the hard questions are best discussed rather than answered, if that makes sense.
Yep.
In passing conversations that you and I have had, and I know I've had with others, so I can only assume you've had them as well, a lot of people will point to abstinence being one measure of success, where other people will say, well, if a person is chronically using or habitually using alcohol or other substances for a period of 10 to 20 years, and then they enter a life of recovery and have a relapse in the middle of a 12-month stretch where they've only been using for 2 weeks out of that 12-month stretch, can't we call that successful? And my answer is a bit qualified. And I say, well, it depends on how much damage they do in that 2 week stretch. What is the impact they're having on themselves? What's the impact that they're having on their family? What's the impact that they're having on their community? What is their life like after that 2 week window when they decide to re-engage in an abstinence-based living? And that's a question that really is going to change and vary from patient to patient to patient. And that's something that we all need to be very cautious of.
I agree. And I don't think there is a very clear answer on this. If you asked me 10, 15 years ago, even working in the field as a clinician at the time, is abstinence necessary? Is that the key metric that we should be looking at? I would have said yes, absolutely, right. And I think that there's a lot of folks that, with long-term recovery that would say absolutely, abstinence is the foundation of healthy recovery. There's a difference, though. We're talking about treatment, and there's been a lot of progression over the last 10 years to where there's many paths to recovery, and how you define recovery yourself is important, what your own personal goals, right? Being able to guide your own treatment based on what's important to you is a core of how treatment is provided, right? So is there a clear answer? No, I don't think there is. However, I do tend to default to, if you've been diagnosed with substance use disorder, then at least some degree of abstinence for a period of time is going to be necessary to really figure out what else is going on, what are symptoms of that substance use, what other problems need to be addressed, and really for things to clear up to develop healthy goals and relationships. With that being said, kind of same question, different way of saying it, I suppose, is can treatment be effective if an individual does not maintain abstinence?
I think that treatment always has the potential to be successful regardless of the immediate outcome, because we don't have any way of anticipating whether or not treatment is going to be effective today, tomorrow, next week, or next month, or next year, right? Addiction is one of those tricky issues to treat when it comes to mental health and behavioral health, simply because we find ourselves in a position where if I came to you as your primary care physician and I said, Tommy, you've been smoking for 30 years and you have advanced emphysema, 9 times out of 10, you would quit smoking. Addiction doesn't work that way. Time and time again, we see medical professionals confront their patients with considerable data which tells them that they have a problem. And we see patients consistently respond with continuing to engage in that repeated behavioral pattern, engaging in substance use, engaging in drinking, and time again continue this process over time. My concern, particularly when it comes to evaluating success, is I know that if I have a client or a patient come in for an assessment and they engage in a recovery lifestyle where abstinence is the foundation for it, their lives will get better. It's a given. And there's absolutely no doubt in my mind, professionally or personally, my experience on both sides tells me the same thing. I know that if they relapse at some point in their treatment process or in their lifestyle post-treatment, then the likelihood of them being able to retain a continued recovery lifestyle where there's a reduction in some of the co-occurring issues and some of the problematic behaviors, the chances of those recurring is significantly greater. So I can't say that eliminates any paradigm for success. I can simply say that the odds are greatly reduced if abstinence is not the goal, if not the expectation.
Yeah, I can't help but think too, we look at, I mean, treatment is treatment. This is something that is, were it any other type of medical procedure, a treatment would be just that, right? We're providing a treatment for something. And we talked about it if diabetes, I think diabetes is probably one of the best parallels to substance use disorder, to anything that we would term an addiction, because you have a physiological medical component and what is very much perceived as a behavioral component mixed in. So, someone whose diabetes is effectively medically stabilized, that's an effective treatment, right? But down the road, if there's a lapse into symptoms, if a behavioral component or a medical component triggers the symptoms of diabetes to become, increasingly severe, that wasn't failed treatment.
Absolutely.
Okay. And from our standpoint, it does do what, recovery communities would say in terms of lowering the bottom, right? Meaning that individuals that receive effective treatment sooner and earlier in their lives have a better chance of achieving long-term recovery sooner than they would without those treatments, even if it's not immediately following that episode, right? And that's really important for us to keep in mind for this field. In the same respect, something that you said that has stood out to me for a while, and again, I like to reference what they're doing with behavioral health and severe and persistent mental illness with like housing first, for instance, where this idea of meeting someone's basic needs actually is going to have a direct impact on their health and wellness and the outcomes of treating the mental illness, right? And we have always had it reversed in substance use disorder. We've always said, no, you got to stop doing this and then you'll get this. It's kind of like the carrot. And the reality is what you said, if someone's life is getting better and they're starting to experience some positive things in life that they hadn't been experiencing, they're more likely to make positive choices or apply additional effort in addressing the things that are causing them problems.
That's true.
Yeah.
And it becomes a double-edged sword. And this is where I think recovery informed treatment is so critical. we see so many relapses occur when things are getting better, not when things are getting worse, right?
Mhm.
Um, a person in recovery would look at that and say, well, that's simply because we know how to manage. When we're active in addiction, we know how to manage chaos. We're used to it because it's around us all the time. When things start to get better and the chaos is starting to subside, we're not really sure how to deal with a serene lifestyle. And those are the problems that we run into consistently. So I know that recovery informed treatment is something where we're trying to equip our patients and our clients with the ability to understand that that is the desired outcome, and that we're preparing our clients for that reality, for that eventuality, equipping them with tools and coping mechanisms to be able to understand that being in a good place where life is peaceful and they can enjoy happiness and joy is the desired outcome, and that's okay, that they're actually worthy of that, that they deserve it, that they've earned it, that they're working for it, and that they need to appreciate it and be grateful for it in the moment. That's a very difficult thing to explain to clinicians who are looking at addiction as something that requires a set treatment with a set modality. It doesn't negate the need for it, but it does mean that it needs to be complemented with something more comprehensive.
I like that. I want to kind of address something else too, which is where we started in this conversation. So, as a person in long-term recovery, right, the subjective, the part of me that would infuse lived experience into my work with a patient, right? Um, for me, abstinence was key to the foundation of long-term recovery that I have today. And today, were I to use a substance, abuse a substance, my recovery would start to fall apart very rapidly, right? So personally, I do believe um, if you have substance use disorder, if you consider yourself alcoholic or addict by the kind of recovery definition of that, the peer support community, um, I would say abstinence absolutely is a primary goal, and that long term achievement of other life goals is going to be dependent on maintaining that abstinence.
I think that
Right.
that's true, but we also need to be mindful in the peer support community, whether it be a 12-step program or another peripheral program. We need to be conscious of the fact that relapse is a very real part of the recovery process, and that it's not something to be shied away from. It's not something to be shunned. People who relapse ought not be ostracized, but embraced back into the recovery process and simply accept it and say, it happens. It's no big deal. Let's learn from it, apply it so that we can really re-engage in recovery and re-engage in the abstinence-based lifestyle.
Yeah, I agree, and we'll close out this segment and look at the next. So I want to say that what you just described is one of the things that attracted me to working with you all at New Paradigm, and that was outside of the professional realm. It was Dave, Joey, yourself. I sat in a room in a recovery room with you all and watched how you interacted with people that were struggling, and it was pull them closer. It wasn't shun them or awkwardly distance oneself because they were too difficult. It was pull them in closer. And outside of New Paradigm, there's this huge fellowship, um, home groups of folks that are close because they've struggled and struggled and struggled, and then it clicked, and here they are today, thriving and doing well and carrying that message. And one of the coolest things about New Paradigm Recovery is that that is an integral part of the ethos, right? It is the recovery informed theory that is really born of principled practice in everyday life. And I don't think uh, that comes easily. But it's one of the things I think that really makes the work you all are doing, we are doing together, so special. So, with that, please comment in the comments if you disagree. Great. Let us know how you disagree. If you agree, I'd love to hear that. If you have some additional thoughts that we're not thinking of, we're all ears. This is something that we're really excited about. So we'd love to hear from all of you.
The engagement matters.
Thanks, everyone.
Thanks very much, Paul. See you next time, Tommy.